We are anonymous, and this is what we uncovered behind the closed doors of the Oval Office, a scene where pomp, promises, and a medical emergency collided in one explosive moment. Strap in, hit the like, subscribe, and ring the alert bell because what we expose today matters. It began with Donald Trump, once again standing in the Oval Office, under the glaring cameras and the blinding lights, promising to slash drug prices for the American people by like 1000 or 500%. That's not a typo. It was his claim. He confidently declared that under his leadership, Americans would pay far less for prescription drugs, dramatically less. And then reality punched through the spectacle as Trump stood before the press, introducing a historic agreement with pharmaceutical giants, Eli Lilly and Company and Novo Nordisk, to cut the cost of those so-called fat loss drugs like GLP-1 obesity treatments. A speaker collapsed. Right there, mid-speech, the cameras froze. The press was rushed out of the room. The lights stayed on. The media later reported the collapsed individual was associated with one of the pharma companies and that Trump himself was okay. Let's rewind. Trump had assembled a motley cast of players: Stephen Chung, White House Communications Director; Robert F. Kennedy, Jr., appointed Secretary of Health and Human Services; Mehmet Oz, then head of CMS Howard Lutnick, and others all gathered to witness this moment of triumph. But the real story behind the scenes? It's messier. Trump, in casual conversation on camera, began outing one of his staff's medical status, pointing at Stephen Chung. He's taking it, referring to the weight loss drug, in earshot of press. Talk about invading privacy. He then repeated the promise. We're cutting it by 1,000%, 200%. Nobody's ever said a thing like this. Of course, the math doesn't make sense. Cutting something by more than 100% means you're paying them to take the drug, not you taking the drug. Yet he said it publicly. Meanwhile, the agreement announced was no mere rhetorical flourish. According to multiple sources, the deal between Trump, Eli Lilly, and Novo Nordisk would reduce the monthly cost of GLP-1 weight loss drugs from around $1,000 or more to something between $149 and $350 for cash payers, if approved, and around $245 for government programs like Medicare. Co-pays for Medicare patients were to be capped at $50. That sounds good on paper, but hold on. The eligibility criteria were strict. Only patients with a body mass index, BMI, above 27 and other health conditions, or BMI over 35, or kidney disease, or heart disease. That excludes many patients. And the timing. Mid-2026 for Medicare rollout. Later for Medicaid, and the cheaper cash price tiers still raise questions about accessibility. Back in the Oval Office as Trump hyped the platform, TrumperX.com, later TrumperX.gov, he claimed it will launch before the end of the year, and that he didn't want his name associated with another cost overrun like the train project in California or the beautiful Obama building in Chicago. Yes, he dragged Barack Obama into it once again. He is still obsessed, it seems. He warned the press, I don't want to be like the train they're building in California, all the while announcing the platform that will bypass insurance. But let's talk about that medical emergency for a moment. The press cut away as a speaker collapsed. The White House medical unit claimed the visitor was okay, but the optics were clear. When you're announcing a historic deal about health care, even while violating someone's privacy, live on camera, something in the room itched, and someone collapsed. It's symbolic. The promises were big, the foundation shaky, and the execution unclear. And yet if Trump actually pulls this off, if those drug price cuts materialize, if more Americans begin accessing obesity and diabetes treatments at vastly lower cost, it could be a big deal. Obesity affects 40% of American adults. Chronic disease costs the country trillions. So the stakes are high, but will not take anything at face value. Because while the headlines promise $150 per pill and $50 copay, the devil lurks in the details: eligibility, pharmacy, networks, insurance coverage, timing, and real patient access. Several analysts caution that while the upfront numbers look dramatic, real access may remain limited and complex. Let's not forget the human drama. Trump publicly shamed his staff's medical use, outing Stephen Chung's weight loss drug usage, invading privacy under the pretense of reform. That speaks to the culture inside the administration. Bluster, showmanship, exposure. And then a person collapses. A microphone dropped. Cameras cut. The narrative stalls. And perhaps the real story, in the pursuit of historic deals and big cuts. The administration tripped on its own performance. So here's what you should ask. Who actually qualifies for these lower prices? Will they directly benefit? Or will they benefit only a subset while others get left behind? Can such radical cuts be sustained in a real market of high-cost pharmaceuticals and entrenched insurance systems? And what happens to all the other drugs, not just GLP-1s, when this most favored nation pricing hits the market? Trump's fact sheet says this agreement also pushes insulin products to as low as $35 per month and migraine treatments to $299 per pen. But beneath the numbers lies the deeper game. Trump's so-called TrumpRx.gov brand isn't just a healthcare program, it's a political weapon. Every pill sold, every discount code, every televised announcement becomes part of his re-election campaign. The smiling faces, the Trump saved you money ads, the labels stamped with his name. It's not healthcare, it's marketing. Analysts already note the eerie similarity between this and his earlier Trump stakes and Trump University branding tactics. The difference is, this time, the stakes involve actual public health, not overpriced beef or fake degrees. And the cast he assembled is equally alarming. Robert F. Kennedy Jr., known for spreading vaccine conspiracy theories, now serving as Secretary of Health and Human Services, echoing pseudoscience about Tylenol and autism. Dangerous misinformation that experts have repeatedly debunked. Mehmet Oz, once a TV doctor, now shaping public health policy from the White House. These are not doctors serving science. They are celebrities serving Trump. Every false statement, every unproven claim becomes state policy under his administration. It's a dangerous combination. Misinformation dressed up as reform spectacle, disguised as progress. And through it all, Trump plays the same tune. Make an impossible promise. Declare victory before delivery. And move on before accountability catches up. When the crowd cheers, he smiles. When reality pushes back, he blames others. When someone collapses beside him, the show continues. That's the cycle. But the American people are paying attention now. They remember his earlier biggest ever claims on infrastructure, on jobs, on vaccines, on the wall, that fizzled out once the cameras were gone. They see the pattern, loud promises, little follow through, endless spin. And yet millions still buy the illusion, hoping this time will be different. We've seen it before. The lights flash, the crowd claps, and Trump declares himself the hero of another historic day. But history, real history, will judge by outcomes, not applause. Will this deal truly save lives? Or is it another branding exercise for a man obsessed with seeing his name on everything from buildings to bottles? In short, the spectacle was delivered. The promise was made. The collapse happened. And now we wait for the follow-through. Will the math add up? Will the announcements become reality? Or will this simply join the long list of grandiose Trump claims that fail to deliver? Remember, cut by 200% is nonsense. You cannot cut by more than 100%. That alone tells you the difference between showmanship and substance. We are watching. We are holding the light in the shadows. And we call on you. Don't just accept the headline. Dive into the details. Ask hard questions. Demand accountability, because when the deal is announced and the cameras leave, millions of Americans will still be waiting for those drug price savings to hit their pharmacy counter. Smash that like, subscribe if you haven't yet, tap the bell and join our network. We will keep tracking this story. We will keep digging, because your life and health should not be part of a theater.